proud of the wonderful staff that we have in our health services. And over the last number of months, as they battled through COVID, Minister, we all gave them a clap on the back. We commended their heroics, and rightly so. And I've met many of them, and I can tell you that they are hungry for change in healthcare. They want things to be different. They want the tools to do the job. They don't want any more claps on the back from politicians. They want us to do our job, which is to provide the resources to the public system to enable them to give better treatment to patients. They're on the cold face of this. We're talking here about 1.3 million people who are on hospital waiting lists and community waiting lists. The people who are dealing with these patients every single day are staff, and they want the tools to do the job to provide better healthcare. One of the features of the Irish healthcare system, Minister, is outsourcing. It's something that we're very good at. We outsource treatment to private hospitals, and even in your plan that you announced, we're going to see more of that. We outsource diagnostic tests, even though we have 225,000 people waiting for a diagnosis. We outsource cancer screening, and let's be honest, we saw the consequences of that in recent years. We outsource employment of staff through agencies, which cost huge amounts of money. So more and more outsourcing, Minister, means less and less capacity in the public system. But we don't just outsource hiring staff or outsource services. We also outsource responsibility. And it seems to me we have an absolute failure of accountability and responsibility within the Irish healthcare services. The people at the top who run the health services get mega salaries, multiples of what anybody in this chamber will get, and yet we don't have accountability or transparency. At the top in the health service, where targets set are missed over and over again, and it permeates right down into local hospitals, where again we can see major problems in some hospitals, and I have to say, in some cases, Minister, it's simply bad management. If I was the Minister for Health, of course I would put capacity into hospitals where it's needed. Of course we have to look at minor injuries units like the ones in Monaghan that need to be properly supported, and if I was Minister for Health I would do that. But there's also an awful lot more we can do. We have to bring about a new culture of accountability and transparency in the Irish healthcare system. You outsource responsibility for the waiting list plan and Sláinte Care to the two people whose responsibility it is to manage the day-to-day running of our health services, the Secretary-General of the Department and the head of the HSE. You should have taken responsibility. And of course the people who were leading healthcare reform, the people whose sole job it was to drive the healthcare reform, left. They resigned from Sláinte Care because they saw that you and your government were not committed to the reforms which are necessary. They did not see action on waiting lists and their right. They did not see action on e-health and their right, and they did not see action on regionalisation. And I have to say, Minister, when you outsource responsibility, and then when there is failure, you as Minister for Health have to take responsibility. I said earlier, and I was 100% sincere, I welcome and I celebrate every additional cent that has been put into our health services over the last 2 years, and I recognise that additional investment was made. I also celebrate every single additional staff member that has been brought into the health services, and we need many more. But we also have real problems with recruitment and retention. You know, Minister, that, and you've railed against this yourself when you were in opposition. We're not training enough healthcare professionals. We need to train more. There are real problems with recruitment. We need to deal with that. There are real problems with retaining staff. We need to deal with that. We don't have enough surgical theatre capacity, diagnostic capacity. We don't have enough beds in our acute hospitals, so patients can't be admitted quick enough. We don't have enough capacity in the community sector. We don't have the cohesion and the integrated healthcare system that we need. And unless we deal with those structural problems, you are going to come in here with reports and with strategies that you believe in your heart will work, but I can tell you that they will not. Listen to the Irish Nurses and Midwives Organisation, listen to the Irish Medical Organisation, listen to the Irish Hospital Consultants Association, who are all saying that your plans and your strategies will fail because you are not making the investments and the changes in healthcare which are necessary to take people off trolleys and off waiting lists and deliver better healthcare for patients.